Several times mothers want to know why has their child got runny nose, cough, fast breathing? How can it be prevented? So today I'd be telling you something about the respiratory syncytial virus, also called the RSV, which results in upper respiratory tract infection in children, and it can also go down and cause bronchiolitis or pneumonia like symptoms when it goes further down into the respiratory tract. Majority of times this infection is not severe and resolves by itself with supportive care, but in about 2 to 3% of children it becomes severe and it requires hospitalization. Not only does it require hospitalization, it might require intensive care and it might have an adverse outcome in small percentage of children. So this respiratory syncytial virus is a single-stranded RNA virus. How can we protect it? We can protect our children in a few ways. One is that in mothers between 32 to 36 weeks of gestation, if we give the RSV vaccine, then it will protect the child for the next 5 to 6 months. However, this vaccine is not available in India. So what can we do? When this vaccine is not available, then we have a medicine called nirsevimab. This can be given intramuscularly to children on the anterolateral aspect of the thigh as soon as possible after birth, prior to discharge from the hospital. If this child has not received it prior to discharge from the hospital, then it should be given as early as possible. It can be combined with routine immunizations, and it should be given in the first RSV season as the child enters it. The first RSV season is usually in the winter months. So here in our country, it would be sometime after August up till March. Children who have been born premature, children who have had immune deficiencies or are suffering from immune deficiency, have congenital heart disease, lung malformations, cystic fibrosis, etc., are at increased risk of RSV having an adverse outcome. So in that case, it can be given up to the 12 months of age, but WHO says it should be given in the first 6 months of life. If the child is high risk, up to 12 months. Beyond 12 months, it's of not value at all, because the child has already been exposed and has developed antibodies of his or her own. So now the dose of nirsevimab is based upon the age of the child, the body weight of the child, and the RSV season that is there. So it is an expensive drug. It is not given free of cost by the government system, and it can cost anywhere around 35,000-40,000 per injection. So that much about RSV. A little about the symptoms of RSV. If there's an infection, it can have, runny nose. With runny nose, there could be, sneezing, coughing, and after coughing, fever can happen with wheezing and pneumonia. Now, if the child has already got a upper respiratory tract or a lower respiratory tract infection where RSV is suspected, then giving nirsevimab is of no value. It should not be given. You should go to a doctor who should treat the child. So in brief, RSV is preventable. It causes about 1/3 to half the cases which present with cough, fast breathing, pneumonia, and you should be careful about taking care of these children and get good medical opinion fast. Thank you for listening to me.